Hi, this is Kia and welcome back to my channel. I just wanted to talk to you all about a few things that you want to get prepared for in order for you to prepare for a nursing job interview. The first thing that I wanted to talk to you about is something that you want to start to prepare and gather while you're still in nursing school. And that is you want to get references while you're still in nursing school. You want to get references from your director of nursing, the director of the nursing program, from your nursing professors, as many as you can get. You want to collect those things while you're still in school, which means that you want to, you know, behave in a way that your professors would be more than happy to give you a letter of recommendation. When you get those letter of recommendations, make as many copies as you can because you will use those throughout your entire career as a nurse. The next thing that I would say is to make sure that you have prepared copies of your resume, your CPR certification, your 1 or 2 step tuberculosis testing results, and also your nursing license. You want to make multiple copies of these things as well, even as you update and renew your CPR and your TB testing and your nursing license. You want to make sure that you keep copies at all times. Um, and then the next thing, as I'm looking at my notes here, the next thing that you want to make sure that you know is the formula to calculate drug calculations correctly. You're probably going to have some calculation and dosage calculation questions on the competency testing part. So you want to make sure that you know that and that it's in the forefront of your mind. You also want to make sure that you have brushed up on knowing the most common drug names, generic and brand name. You want to make sure that you know, and I don't know if nursing schools are teaching the 8 rights, because there are 8 rights to a medication pass, and that is the right person, the right medication, the right reason for the medication, the right dose, the right route, the right frequency, the right time, and the right site that you are administering the medication. You want to make sure that you know those because there will be some questions. I can almost guarantee that there may be some questions on the competency exam that's going to question if you are familiar with that. Um, Also, another thing that you might want to consider is what you will do in the event of a fall. I remember I applied for a job, and that was one of the questions that I was asked. And I left out one important piece, and that was just because I was a new nurse and I wasn't thinking like someone who had already worked in nursing. So I missed this step. And I'm thinking that the things that I need to make sure is that the patient is okay, doing an assessment, checking to see if there's any injuries, things like that, starting neurological checks. But the one thing that I forgot to mention as my first portion was that I was going to notify the doctor that the patient had fell. In my head, I knew to notify the doctor, but as I'm writing it out, it's like, of course I notified the doctor. Why would I write that? It was like, I assumed it was like it was understood that the doctor was called. And you want to think about that. You don't want to assume, and you want to break things down step by step if you are asked a question and what you would do in the event. You don't want to assume that somebody else done called 911, that somebody else done grabbed the AED machine, and somebody else done did that. You want to write down what you would do step by step. So if you're asked that question, just think about it. Just think about that question really hard. What would you do in the event of a fall? How would you handle it? Because they want to know about your ability to make the right decision and to react the correct way in the event that something like that does happen. And more than likely, it will happen, in a nursing setting. So you want to get familiarized with that. So that was pretty much it for this video. Just wanted to come on really quick. I hope that these videos are helping someone. I am getting back into the groove of making videos and just speaking about nursing from a nursing standpoint. And these are just my opinions. This is not um, nursing legal advice, or, you know, I'm just giving you my perspective and my opinion from being a nurse for almost 5 years now and being out there in the field, and just trying to give you guys a glimpse of what life is like and some of the things that you may face and things that you might want to consider on this nursing journey. I thank you all for watching, and you have a wonderful day. And I'll talk to you all later.